Health insurance plans are designed to help individuals cover the costs of medical care. One important aspect of these plans is the network type, which refers to the group of healthcare providers that are covered by the plan. There are 4 main network types in the United States: health maintenance organizations, HMOs, preferred provider organizations, PPOs, exclusive provider organizations, EPOs, and point of service, POS, plans. Each network type has its own set of rules and guidelines for selecting and using healthcare providers, and understanding these differences is key to choosing the right health insurance plan for your needs. Health maintenance organizations, HMOs, are often the most affordable type of health insurance plan. They require you to choose a primary care physician, PCP, from within the network, who will manage your overall healthcare needs and provide referrals to specialists when needed. HMOs generally have lower out-of-pocket costs, but you are limited to using healthcare providers within the network. Preferred provider organizations, PPOs, offer more flexibility in terms of healthcare provider choice. While they still have a network of healthcare providers, PPO plans allow you to see healthcare providers outside of the network for a higher cost. You do not need to choose a PCP with a PPO, and referrals to specialists are generally not required. Exclusive provider organizations, EPOs, are similar to PPOs, but they do not cover out-of-network care. This means that you are limited to using healthcare providers within the network, but you do not need to choose a PCP or obtain referrals to see specialists. Point of service, POS, plans combine elements of both HMOs and PPOs. They require you to choose a PCP from within the network and obtain referrals for specialist care, but they also allow you to see healthcare providers outside of the network for a higher cost. When choosing a health insurance plan, it is important to consider your healthcare needs, budget, and preferences for healthcare providers. Understanding the different network types can help you make an informed decision about which plan is right for you. In addition to the network types mentioned above, there are also hybrid plans available that combine elements of both HMO and PPO plans. These plans are typically referred to as HMO POS or PPO EPO plans. When considering a health insurance plan, it is important to take into account your personal health needs and budget. HMO plans can be a good choice for those who prioritize low cost and are willing to sacrifice some flexibility in choosing healthcare providers. PPO plans may be a better choice for those who want more freedom in choosing doctors and hospitals, but are willing to pay higher premiums and deductibles. EPO plans can be a good middle ground for those who want some flexibility but also want to keep costs lower. POS plans may be a good choice for those who want to have more flexibility in their healthcare choices, but want to keep costs low and don't mind having to choose a primary care physician. It is important to note that regardless of the type of health insurance plan you choose, there may still be out-of-pocket costs that you are responsible for, such as co-payments, co-insurance, and deductibles. It is also important to stay informed about any changes to your plan, such as network changes or changes in coverage for certain medications or procedures. Overall, navigating the world of health insurance can be complex and overwhelming, but understanding the different network types and how they work can be a helpful starting point in choosing the right plan for your needs. Out-of-pocket costs are an important aspect to consider when choosing a health insurance plan in the US. These costs refer to the expenses that the insured person is responsible for paying, beyond the monthly premiums. Understanding these costs can help individuals choose a plan that meets their healthcare needs and budget. One type of out-of-pocket cost is a copay, which is a fixed amount that the insured person pays for a specific healthcare service. For example, a plan may require a $20 copay for a doctor's office visit. Another type is coinsurance, which is a percentage of the cost of a healthcare service that the insured person is responsible for paying. For example, if the coinsurance for a medical procedure is 20%, the insured person would pay 20% of the total cost of the procedure. In addition to copays and coinsurance, health insurance plans often have a maximum out-of-pocket limit. This is the highest amount of money that the insured person will be required to pay for covered healthcare services in a given year. Once this limit is reached, the insurance company will pay the full cost of covered services for the remainder of the year. It is important to note that out-of-pocket costs vary by plan and can greatly impact the overall cost of healthcare. Some plans may have higher premiums but lower out-of-pocket costs, while others may have lower premiums but higher out-of-pocket costs. It is important to consider both the premiums and out-of-pocket costs when choosing a health insurance plan that fits individual needs and budget. In conclusion, understanding the various out-of-pocket costs associated with health insurance plans is crucial for making an informed decision about healthcare coverage. Co-pays, co-insurance, and maximum out-of-pocket limits are important factors to consider when choosing a plan that provides adequate coverage at an affordable cost. Another type of out-of-pocket cost is co-insurance, which refers to the percentage of the total cost of healthcare services that you are responsible for paying after your deductible has been met. For example, if you have a co-insurance rate of 20% and the total cost of a medical procedure is $1,000, you will be responsible for paying $200 while your insurance company will pay the remaining $800. It is important to note that some plans may have different co-insurance rates for different services, such as a higher rate for out-of-network care. In addition to co-pays and co-insurance, many health insurance plans also have maximum out-of-pocket limits. This is the maximum amount you will have to pay for covered healthcare services during a plan year. Once you reach this limit, your insurance company will pay for all covered services for the remainder of the year. The maximum out-of-pocket limit can vary depending on your plan and may include deductibles, co-pays, and co-insurance. Understanding these different out-of-pocket costs and how they work is essential when choosing a health insurance plan. It is important to carefully review the details of each plan to determine the costs associated with co-pays, co-insurance, and maximum out-of-pocket limits to ensure that you choose the best plan for your needs and budget. Covered services, essential health benefits and preventive care. In the United States, health insurance plans are required to cover certain essential health benefits as part of the Affordable Care Act, ACA, which was enacted in 2010. The ACA mandates that individual and small group health insurance plans cover 10 essential health benefits, while large group health insurance plans are required to cover essential health benefits, but have more flexibility in the specific benefits covered. The 10 essential health benefits that must be covered by individual and small group health insurance plans include ambulatory patient services. This includes outpatient care received in a hospital or clinic, as well as diagnostic tests and X-rays. Emergency services. This includes treatment for emergency medical conditions that require immediate attention. Hospitalization. This includes inpatient care received in a hospital or other healthcare facility. Maternity and newborn care. This includes prenatal care, delivery, and postnatal care for both mother and baby. Mental health and substance use disorder services. This includes behavioral health treatment, counseling, and therapy for substance use disorders. Prescription drugs. This includes coverage for both generic and brand name prescription drugs. Rehabilitative and habilitative services and devices. This includes physical therapy, speech therapy, and occupational therapy, as well as medical equipment and supplies. Laboratory services. This includes testing of blood, urine, and other samples to diagnose medical conditions. Preventive and wellness services and chronic disease management. This includes services such as annual checkups, immunizations, and cancer screenings. Pediatric services, including oral and vision care. This includes routine dental and vision care for children. In addition to the essential health benefits, health insurance plans are required to cover preventive care services without cost sharing, such as co-pays or deductibles. This includes services such as annual physical exams, immunizations, and cancer screenings. It's important to note that while health insurance plans are required to cover essential health benefits and preventive care services, the specifics of what is covered can vary widely from plan to plan. It's important to carefully review the plan documents to understand what services are covered, as well as any associated costs such as deductibles, co-pays, and co-insurance. In addition to the essential health benefits, many health insurance plans in the US also cover preventive care services. These are medical services that are aimed at preventing illnesses or detecting them early, before they become serious or life-threatening. Examples of preventive care services that are typically covered by health insurance plans include routine physical exams, screenings for cancer and other diseases, immunizations, and counseling on healthy behaviors. Under the Affordable Care Act, ACA, health insurance plans are required to cover certain preventive care services without charging any co-pays, co-insurance, or deductibles. These include services such as annual wellness exams, mammograms, colonoscopies, and certain vaccinations. This is meant to encourage people to get the preventive care they need without worrying about the cost, as early detection and treatment can help prevent more serious health problems down the line. It is important to note that not all health insurance plans cover the same preventive care services, and there may be some variation in coverage depending on the plan and the state in which you live. It is always a good idea to review your health insurance policy to see what is covered and to take advantage of any preventive care services that are available to you. In conclusion, health insurance plans in the US typically cover a range of essential health benefits and preventive care services. However, the specifics of what is covered and how much it will cost can vary depending on the plan and the individual's circumstances. Understanding the basics of health insurance coverage can help individuals make informed decisions about their healthcare and ensure that they have access to the care they need when they need it.